So my presentation is there, yes. I would like to give you, first of all, my responsibility is for the healthcare industry in Central Eastern Europe. So Greece is one of the countries that I support, one of the 33 countries which I support. I am not a deep expert in security. You have all the experts here. But I would like to give you a glimpse of IT, healthcare, and security combined together. And it's very clear in in all the sessions that we have seen that this industry, but the healthcare industry, but also I would say all industries are going through a profound transformation. Basically, what is happening is that every asset in our hospitals, including the patient, is becoming digital. Digital means that it's becoming a series of 0 and 1, stored somewhere, okay? And because technology is evolving and is really creating new paradigm in order to process this information, okay? And I'm talking about particularly two areas which are extremely, affecting this transformation, which are the mobility part, and in mobility, I will say that it's the control of also assets like devices, which could be in a mobile environment, but also, the internet itself. And when I talk about internet, and I will talk, and I look at internet in terms of maturity, this translates with cloud technologies. Cloud technologies is the way how we can build and deploy the most modern kind of applications that the industry can receive, and it's affecting also the healthcare industry. Now, we recognize that because of these two capabilities, mobile and internet, and then for cloud, that we really need a new way to consider the technology, a new way which is considering security in a different aspect, but also other aspects like compliance and be sure that things are done according to what you expect as a user, as an organization. We call this trustworthy computing, okay? And we have created already 15 years ago all of a series of activities inside Microsoft to build products and build strategies and build processes in order to be sure that our technology can deliver a trusted environment, okay, for our customers. In order to then create this as an enabler for the opportunities that we have, specifically in this case in the healthcare. So, now, the healthcare industry, it's under profound transformation. You can see in a different aspect, but the reality is that what is happening is being debated, in these 2 days quite heavily. Okay, aging of population and the maturity that we have reached in some technology like telemedicine. It was very interesting, some presentation that was made here in, for example, from Norway, where we have seen the telemedicine, which have 25 years of, let's say, experience, has been translated like an healthcare strategy for the nation, And the reality is actually in that going that direction, because when you talk about telemedicine, you talk about a mobile environment, you talk about digital devices, medical devices. You talk about a communication between patient and doctors, which is happening, okay? And then you have, all the capabilities which are, connected to the technology. So the combination of these parts together with the technology is really creating a big challenge for our organizations. And the way to see it, as I mentioned, trustworthy computing, translate in 4 principles, okay, where security and cybersecurity is one component of it, okay, but we need to mention also the compliance, and we have important rules coming from the European community, from other board, other members, other regulators, which are extremely important to identify and build, identify requirement and build environment which are trustworthy, which are secure by nature. Transparency, okay, because this is important, for our customers, and it's important because the reality is that you need transparency across all the value chain, from doctors to patients and to organization, and so you need to have technology which are enabling this transparency. Privacy and control and security. In security, I would say that, again, is not a matter of saying that I'm secure because I settled for example, a firewall. The reality, because of the nature of the market, it needs to go beyond the specific product capabilities. It's becoming a practice, it's becoming a process, it's becoming something that affects people. It's not only a technology part. Okay? So when we say trusted cloud, trusted technology, we need to consider all these four elements. And then the anxiety about security. And when we talk about cybersecurity, we are not talking anymore about these young people, the hackers, which are sitting somewhere, which are jumping to your system and say, "Hello, I am here," right? Now it's a crime. Now the reality is that we have seen examples daily, including these recent 2 days, where these attacks are really focused and becoming really a market, okay, a black market. A stolen patient record has a market. I was reading recently for this. The cost of a patient record is in the market is $70. So if you stole, you can have someone to buy. So it's and stealing a credit card number, it's less than $1. It's 70 cents. So it's it's something that it's happening, and we need to protect ourselves, our patients, our citizens, with technologies which are preventing this, and this malware is becoming more and more intelligent. And now we have really an urgency around something which is called ransomware, which is very, very dangerous because it's happening especially in countries like US and in HealthCare, where these criminals are entering the network and they are encrypting the information. And then they are asking money to decrypt and make the resources available again. And this is becoming a market. And they are asking money through a process of Bitcoin, which you don't know where the money is flowing, but they are asking money. So, and the money they are asking per hospital, I have some examples from $100 to $1,000. And if you look at the news, it's happening every day, and I'm sorry to say that it's happening also in my region, because I already have two examples coming from my colleagues, which is happening in our region too. So it's becoming an urgency, this part. Where we need to look, okay, so we have some reports, and this is a very interesting report which is coming from Verizon, which is, saying that where are the glitches, where are the issues, okay, and basically organized according to specific pillar. But if you look at the difference between the whole industry, across all industry, and what is specific on healthcare, you see that there are two areas which are really jumping up versus, the average for all industry. Privilege misuse and theft and loss, okay? Now, if I translate this in a very simple word, this is coming from people. The real issue is that we need to focus on people that are accessing our network and give them the tools and protect, and in order to protect and access the assets in a secure way. So we need to build products which are easy to use and make the job that they have to do in order to allow the access to the network and to the resources in a very, very controlled way, personal way. Okay? And I will explain what we do at the end on products, but this translates in product strategies, okay? Translating product strategies. So people needs to be very well identified. So identity management for devices, it's extremely important. Now, in order to address all these complexities, you need to have a process in place, and you need to have a clear strategy that for us in Microsoft, because of the cloud-first, mobile-first approach that we have in our product development, it consists in 3 points. You need to protect yourself with the specific software. Okay? When I say protect, I can say, technologies like in Microsoft we call Active Directory for security. Okay, there is a specific capabilities. Be able to detect the malware, and there are statistics which are showing that sometimes we detect the malware 3-4 months after is entered in our network. And in these 3-4 months, they've been able to capture a lot of information that are unbelievable, and we don't know it. So we need to detect immediately and then respond. Okay, so this needs to be done quickly. I want to mention that this is clearly a process. Is not only a product approach. It was mentioned also before by our colleague, the fact that we need to have specific people, architects. We need to have a specific procedure. We need to follow some rules which are coming from the standardization, but it's not enough. It needs to go beyond. And every hospital needs to have their own processes to protect, detect, and respond to cybersecurity attack. I want to show you a video of something that we are doing in our cybersecurity control center. We, as Microsoft, we have a network of, which include also our customer, which are part of our, hybrid cloud and hybrid network. Of more than 1 million servers in Microsoft 100 data centers. So we have created a unit that is actually detecting, responding to the issues, okay? And I want to show a video about something which is called intelligent graph, on what in real time you can see today in action. So I hope to run this. How you run this let me see. There is no mouse. Here it is. Here it is, okay. I will comment at the end. I hope we can see it. Needs the power, so we could. I hope it's not killing the PC. Here it is. So this is monitoring what's going on in the globe concerning cyber attacks. It's a visual. You see different, responding with colors. Okay, what is happening. And because the systems are exposed to the network with the specific, internet number and so on, we are able to really detect what's going on in every single server, understand where malware is originated and where the malware is going, okay? And understand who is affected in real time. This is using there are several billion information gathered through our cloud, and using a technology which is called machine learning, we are actually translating in intelligence to understand what's going on. This is done in real time, okay? And it's the way how we are providing services to our customers, and we provide this information to our partners as well, okay? When I said detect and respond, this is an example of the stuff, okay? So it's key to have this kind of tools, okay? It's key to have the right people to understand how to act, but it's also important to have clearly a strategy behind, which is focalizing on identity, access, and audit. Let me translate this with products, because at the end, probably it's a good way to touch this part. On Windows 10, which is, and it's not Microsoft saying, the most secure operating system today in the market, which has been, for example, updated by the Minister of Defense in US with 4 million units, it has a set of technologies inside the product in order to make sure that we can detect and defend, okay? And you can see, very interesting technology like Windows Hello, which is very important for the healthcare market, because it enables the login to the network and to all the resources by identifying the biometrics of the person, the face, okay, in particular. We have other technologies to do login, like the fingers and so on. But this is very interesting for healthcare, because there are statistics in the healthcare market which are showing that a doctor spends between 30 to 40 minutes a day to log into different systems. When you have technology like this one, which recognize the doctor by the face and automatically, using technology like single sign-on, is capable to have access to the application that he can use and not other application, okay, because this is another feature that we have, okay, you are starting to, to have the full control of the situation. But there are other technologies which are very important. Everything is connected to the fact that we want to act according to a specific cyber attack in such a way that we can act and react and respond, and not having a malware that is blocking the system. So there is a certain amount of technologies which are enabling this part, which are part of Windows 10 and the other developments like Office 365, like Office. And also we are setting up some contents in the product in order to be integrated with the monitoring application that you have seen before, the intelligent graph technology. This development that we are making, these processes are an investment of $1 billion from Microsoft, which is out of the $11 billion that we do in research and development. This gives you a parameter of the importance of security and cybersecurity in a research and development environment, okay, like Microsoft. Standard compliance, okay, so I think, everything needs to be compliant, and it's a must. We do international, regional, and local compliance. All the products that we have are programmable. So you can program even Skype in such a way that does only what you want to do, encrypting, specific activities that you want to do it, okay? So it's very important to realize that there are specific capabilities that needs to come because of legislation and compliance, local compliance. This can be done, and which are also specific to the healthcare, and you see some example here. Now I leave it to you with the last slide. You will receive this slide, but look at this website, which is the health digital transformation website. You will see here the areas that we are investing with partners like Engage Your Patient, Empower care teams, optimize the clinical and operational effectiveness, and transform the care continuum. But you will find here also trustworthy technology. Inside this web, you will find very interesting documents that are both for users, for hospitals, but also for developers on how to build secure products. Okay, so very important to this website. That's it. Thank you very much.